Ash Wednesday for the Catholics out there, that's why some of us have got a black spot on our forehead. You don't have to be Catholic Christian, maybe, whatever you are, it's Ash Wednesday. What does that mean? That means Santa Claus comes and Easter Bunny comes.
6 weeks.
Shortly. Only reason I'm up here today is because Tom had some issues and he decided that he wanted to not be that active in the organization anymore. And because of that, and because I was the past president, and because I missed a meeting, I am up here in the front, okay? Having to talk to all of you. Now, I like to bring up an important topic because we are missing our president, but two things. It's also a year where we would normally vote for officers, okay? So I am going to take nominations for the next month from anybody who would like to apply for the officers of the organization. That would be a president, that would be a vice president, and at this particular time, we're going to combine secretary treasurer into 3. And that's all. Now, if I don't get volunteers, and if you don't make a meeting, guess who's gonna volunteer? Some of you people out there will be volunteering, and you won't know it until you come to the meeting. So, 2 things, either volunteer of your own free will, or make sure you make every meeting we got coming up, okay?
Can I make a comment?
Yes, ma'am.
Yes, I was not gonna be secretary, and then he twisted my arm. He's a good arm twister.
Yes.
He is.
Yes. I'll tell you, we're gonna have a great election. It's gonna be in March at the next meeting. It'll be a 2-year term. What does that mean? It means you don't get paid, you volunteer for 2 years, and you have the opportunity to tell all of us what to do, and we have the opportunity to listen to that if we want to. Okay, enough about that. There are some other changes going on. I'd like to address the meeting at this time to possibly discuss, because the second thing on here, the chapter meeting location. Nancy, do you want to maybe talk a little bit about that, or Becky, or who would like to talk about the meeting location changes that we've got to have? Do you want me? You talk, Becky.
Well, as a board, we've already met. We know that we can have this room for next month's meeting yet, for the March meeting. And we had been offered the 4 p.m. slot for this conference room, but the board feels that that time of day is not beneficial for either chapter members attending or for speakers to be able to be present easily. So Nancy has created a survey based on board input, and you'll see that on the second 2 pages of your agenda right now. And we'll also be emailing a link to complete this online, should you prefer to do it that way. We're going to collect information and people's opinions through the 10th of March, which is just before our March board meeting, so that we can take that information into consideration for searching for a new place to meet. And because of that new location, we can also open it up to new time of day, new day of the week, and frequency, monthly, quarterly, what have you. Zoom, we're just throwing it out there now. This is the time to kind of brainstorm. So, anything I should have added?
I think that's it, yeah.
Okay.
Becky, just for point of clarity, we can still meet here if we get enough people that say you want to meet here at 4 o'clock. We're open. We're not locked into any particular location. We're not locked into anything. And I love the idea of letting the membership vote on that. That's a great idea. We'll get a little more input hopefully and see what's going on. This is a great room, I like it, but like everything, life changes. It's not that they didn't like us, they just are going to do a different way of doing cardiac rehab, and they will have more dedication with the rehab patients into this room, so they need the space. Next thing on the agenda that I see is the treasurer's report. Becky,
We should
is,
let our speakers talk, shouldn't we?
I don't see that on here.
The very top.
That's why you don't volunteer.
You need more practice, Ray.
Okay, I should have practiced. Okay, ladies and gentlemen, our guest speakers today are to talk heartfelt stories, and the first speaker we're going to have is one of our members and an individual who does an awful lot for this organization. He has done the newsletter. Not only that, he's a good friend. He's a hard worker, supporter of Mended Hearts, and I'm very proud to allow Mr. Bruce Parks to come on up and talk first. Thank you, Bruce.
Probably better hold your clapping until afterwards.
You're welcome
Then you
to
want-
sit down if you like.
Hey,
Well,
sit down.
I'll stand up. Thank you, Ray, for the introduction. I would say that my heart journey, I first heard about it in 2016, but it really started in about 2009. 2009, I was a bit overweight. I had gastric bypass surgery. I lost about 100 pounds, and I've been able to keep it off. It worked very well. I think it was one of the big important changes that I did in my life. One of the side effects of gastric bypass surgery is the possibility that something will happen to your gallbladder. Now, many of you, or some of you, or a few of you, or maybe no one, has had their gallbladder removed because it's one of those organs that really is not as important as your heart or your lungs or your liver or your kidney. And so around the 1st of December in 2016, I had a pain in my chest. And I described it to my wife, and we both agreed that it might be a result of the gastric bypass, and I was having a problem with my gallbladder. It happened on a Wednesday night. I slept through the night. I felt fine. I got up the next morning, took a shower, went to work. By that afternoon, I had a lot more pain in my chest. And I called my wife and said, I think maybe I need to go to the ER, but I'm gonna come home first and you can drive me to the ER. She said, no, you need to go directly to the ER. I said, no, I'm a man. I know that we don't need 2 cars at the ER, so I'm going to drive home and you can drive me to the ER. So we did. We got to the ER and we went in and explained to the person at the front, what my symptoms were. And they sent me back. First thing they do is take x-rays, take blood samples. And a PA came into the room and said, you have pneumonia. My wife said, he does not have pneumonia. He has no symptoms of pneumonia. And the PA said, well, I'm sure that it's pneumonia. I can see it in your lungs. My wife turned to me and said, that's not what's happening. So the doctor came in. He said, you do not have pneumonia. You do not have any problems with your gallbladder. You have PEs, pulmonary embolisms. Your lungs are full of blood clots. And, by the way, you have AFib. I had no idea I had either one of those things. So they did some shots in my stomach to get rid of the problems in my lungs, and that seemed to work, but they held me for a couple of days. And then they sent me off to a heart specialist to deal with my AFib. So I went to the doctor and she was very nice. She said, well, we don't know. There's three kinds of AFib. There's the kind that is sort of intermittent. There's the kind that's persistent. And then there's a kind that's permanently persistent. We don't know which one you have because we don't have enough information about it. So she said, we'll just let it go and see what happens. And I said, okay. She put me on blood thinners, and I went home, and then we got a notification from OSHA. I don't know if people are familiar with OSHA. OSHA is a program. It's put on by Boise University now, Boise State, but it's a program for people who are over 65. You can go to seminars on all kinds of things. Anything from health issues to travel to religious studies. I went to one where a lady gave a talk about signage, signs that you see on the highway, the old signs. And she had pictures of old signs, like maybe some of you are old enough to remember the Burma shave signs, things like that. It was a very interesting talk. Well, we saw one was on AFib. I didn't know anything about AFib, so I went to the talk. And the doctor that gave the talk said, this is the mechanics of AFib. And she spent about an hour and a half talking about AFib, how it happens, what they can do about it, what are the prognoses and all of that. It was a scientific talk about AFib, not a doctor to patient talk. My wife and I got home and said that was very interesting, and then we got a card in the mail from St. Alphonsus. My heart doctor was from St. Luke's. Got a card from St. Alphonsus saying the same doctor that we'd heard give the talk was going to give a talk about AFib to AFib patients. So this was going to be strictly for patients. So we decided to go. This doctor got up in front of everybody and said, how many of you have AFib? So we all raised our hands. How many of you have been told by your cardiologist to just sit and wait and see what happens? So we all raised our hands. She said, that's wrong, and here's why. And she went through the mechanics. And because I have a background in engineering and science, I listened because it's science, it's engineering, it's mechanical stuff. If you have a car that has a thump in the engine, you don't turn up the radio so you can't hear it, you get it fixed. So we went up and talked to her afterwards, told her what I had gone through, what had happened. She said, I want to see you in my office. And she turned to the PA that had come with her and said, can you get them in? And he said, yeah. I was in the next week to see her. And she recommended having a couple of ablations done on my heart. Ablation is where they cauterize the cells on your heart that are misfiring. And they do it two ways. One externally by laparoscopic surgery, and one internally where they go up through your vein and into your heart, and then this little probe they go around and cauterize inside. I had both of those done. I came out, and a gentleman with white hair and a red shirt walked into my room in the hospital and said, there are people around that can talk to you about your heart and about things going on. His name was Jack Marr. And so that's how I got involved with this. That's how I got a red shirt. That was in 2017. Since then, I've had another ablation. I've done a lot of research about AFib and about heart stuff, and I have been fortunate to get very good doctors. My cardiologist is now Dr. Nelson, who a lot of you have heard about and know. He's been here for talks. And he told me, he says, AFib is not going to kill you, but we need to treat it. We need to keep working on it. So he says, now I can see you once a year. And I said, I'd like to come in maybe twice a year. He said, that's fine. My advice to people, go see your heart doctor, go see any of your doctors as often as they'll let you. If they say, come in every year so we can have a checkup, how about every 6 months?
Exactly.
And have a checkup? At our age, there's nobody that's under 40 here now, so I recommend going in. I still have AFib, it's under control. I take a blood thinner still because I have a history of PEs. But my recommendation is get good doctors, get somebody that's interested in what you're doing, both in and out of the hospital. And I feel very fortunate that I've had good doctors and I've had a good support group in all of the people here to take care of, to listen to me and to listen to others. It's just been and knowing what's going on is very good medicine. If you know what's going on with your heart, if you know what's going on with your body, you're gonna be a lot better off than if you just say, turn up the radio, so I can't hear it. So that's my story. Any questions? Yes?
Didn't Dr. Beloka feature you in a video as well?
She did. I was so impressed with how that group handled things with me that I volunteered to, I said, if you need anybody to write up, do a Yelp review or something, and they said, well, could you come in and do an interview? And so I did. They filmed it. It's on I guess it's still on the St. Al's website if you want to see it. But I think it was very, very good. I enjoyed it.
Well, now you can see why I'm so impressed with Bruce. Bruce taught us two things. If anybody is watching this in the future, number one, go see your doctor more often. I like that idea. And number two, get help. I thought it was phenomenal that you went out, you decided you're gonna understand more about what you had. Too many of us take it for granted. I got a heart issue, I'll be okay, whatever. Don't do that. Bruce, thank you. That was excellent, excellent presentation. You brought a lot of great facts to all of us, and the people might be watching this at home. If you got questions, call Bruce. He's a wonderful guy. Just make sure you pay for the phone call. He's kind of cheap. Make sure you pick up the phone call.
I have a California area code. So.
Oh, that's even more fun. That's even more fun for people. Our second speaker is Barb Perry. Barb is an example of an individual who has come forward to this organization and volunteered and to do things. And we are blessed to have other people like that. We'd like to get more, and we don't want to kill her because we will volunteer her for anything that she's willing to volunteer for.
And sometimes she's not willing to volunteer.
That's correct. But she is going to talk about her heart issue, and we thank her very much for her time today. Thank you.
Thank you, Ray.
I'm gonna sit down.
Don't.
And I have some notes to refer to perhaps if I need to. Thank you for doing your presentation because AFib is something I haven't experienced yet, and I'm hopeful that I won't ever have to. But I do talk to lots of people when I visit who have that issue, and so understanding more about it is really important. Plus, the older we get, the more likely we are to have that experience, so I appreciate knowing more about it. My journey
Well, a lot of things led up to what happened to me coming into the hospital about 3.5 years ago. As my dad, both my parents had hypertension and high cholesterol. And my father died of a heart attack on the tennis court, dropped dead at 67. So it wasn't like a super early heart attack, you know, usually it's 55 or earlier for that, but from that point on, I was super vigilant about heart-related things. So I've always had sort of a borderline high cholesterol, and I worked as a dietitian for 30 years, and so tried to do okay with my diet. I'm still human, so I didn't always do okay. I mean, chocolate is my favorite food, and it's a food group all of its own, actually. But I kept an eye on the labs and the numbers and everything. But I started having some chest pain that I was concerned about back in 2019. So this was the summer before COVID hit. I was scheduled to retire at the end of 2019, and I was going on, I ended up seeing Dr. Hinchman, who has come here as a cardiologist and spoke, and he's speaking next month in March. I went to see, he was working at St. Luke's at the time, so I usually go to St. Luke's for my medical care, and ended up seeing him, and it was a referral from my provider because of the chest pain. So he did a stress test, which actually, as I reviewed my notes from my hospitalization a few years ago, it talked about that stress test and had the results in there, which I'd never really seen before. He just told me the results, but it just says that my results were actually better than average, is what it said. And so he then was, why are you here? You know, your heart seems to be fine. And I said, well, it's because of the chest pain in my family history. And so he said, well, we can do this test called calcium scoring that helps us decide whether to put someone on a statin medication. And I said, yes, I'm ready for that. I want to know more. And so did the test. I was at like the 90th percentile, which is bad. You want to be on the low end of this particular test. So my result was high, and so he put me on the highest dose of rosuvastatin that was available at that time, and I'm still on that today. So that was fine. I was okay, good. Chest pain would come and go, but it was never stayed very long, and I felt like someone had seen me, they paid attention, and I was on the right track. So retired 2019, COVID hit. COVID was COVID. I was pretty active. I went out in 2022, actually, 2021, my goal was to walk, to hike at least 21 miles for the whole year. And I exceeded that. I got to 2080, which was walking at least 8 miles a day, hiking up in the foothills. So, and there wasn't a lot of other things to do, so hiking was really good. Made me feel pretty healthy and strong, and anyway, the couple of years leading up to 2023, my husband and I would do hiking vacations, and everything was fine, and we were scheduled to go to Canada for a 2-week vacation, like the 3rd week in August in 2022, sorry. You know, the years just go by and you don't even know where you're at sometimes. 2022, August 15th, I had the most horrible abdominal pain that I have ever had in my whole entire life. I'd had previous sort of attacks that had, where I just had to lay on my bed and wait for them to go away. And I'd had one about 3 weeks before this that was one of the worst, and it resolved, but this time I was like, something is wrong here if I keep having these attacks. And so I told my husband after about an hour, said, we gotta go to ER. And so he took me to ER at St. Luke's. They were busy, and all I can remember is I was in so much pain, I just found like a double seat where I could just lay down like this and wait until it was my turn to go in. They did a bunch of lab tests, everything was normal on lab tests, did a CT, and I had an enlarged cecum, so which is at the end of your intestinal tract. And it's not supposed to be very large, but it was dilated to the size of a grapefruit, and it had wandered up into the upper abdominal cavity. And it was what they call a cecal volvulus. Volvulus is just a word that means it's like twisted and not normal. So I had emergency surgery for that evening, and so they cut out part of my intestine, sewed it back together. I didn't, everything looked normal except, I had a wound to take care of. Subsequently, so this was the 15th, on the 18th or 19th, looking at the labs, they got concerned that there was a leak on the place where they stitched things together. So they took me back to surgery and cut more of my intestine out, and then sewed me back together. There was a leak, which means they also had to do what they called an abdominal washout. So they'd clean out the insides there because there was stuff that shouldn't have been in there. Sewed me back together, but they'd taken out enough of my intestine that I needed an ileostomy, which is, they put a little hole here and then you have a bag attached so that everything goes in and comes out this way instead of the normal way. And so I had the ileostomy, and then right next to it was the wound from the actual surgery. That wasn't an issue until I went home, but because they put a wound vac on there. I don't know if any of you've had wounds and I counsel people with wound vacs, but I never had one myself. But it's this big heavy thing that's like sucking everything out of there, and you don't have to do anything, but it's helping the wound to heal faster. So my insurance let me have it in the hospital, but they wouldn't pay for it when I went home. Okay, so now we're like 4 days in, my second surgery, and I think it was, I won't even look at my notes because I did all this recently, but it was maybe 5 days after that my white blood count was going up, and so they were concerned that I had an abscess in there. So they didn't have to do surgery again, but they tried to place a drain. And the first time they couldn't do it, so another CT tried to place a drain, couldn't do it. The next day, they still were concerned, so finally they got a drain in there. Nothing really ever drained out of that after they did all that. But, better to be safe than sorry, I guess. So end result was I was in the hospital. Okay, so let me back up a little bit because I sort of skimmed over the hard part of this, because there is a hard part of it. During, I believe it was never quite clear to me, and even going through the progress notes, if it was the first surgery or the second surgery. But during one of those surgeries, my heart started acting up and had some sinus tachycardia and an elevated QT segment. Again, coming to these sessions, I've learned a lot about heart, and hopefully I'll keep learning because I still don't know all of the heart ways, and I know that's abnormal and not good. And so and I had hypotension during the surgery, and so afterwards they did some additional tests to see if I needed some cardiac intervention while I was in the hospital. So they did an echo, and after all of that, what I was told when I was in the hospital there, of course, I'm in pain a lot and just relying on everybody else, and I don't think I absorbed that much, but what they told me and what I remember is that the echo showed my ejection fraction was low, so I had heart failure. It was 30 to 35%. Normal for someone my age is about 60%. And the echo showed that I had a wall abnormality. So they thought that I'd had a heart attack, but they couldn't tell me when. So, but when I look at the notes, the progress notes, you really have to dig through it to find that information. And when they discharge me, on the discharge notes, it has discharge diagnosis. I think it's a septal infarct, which was not the reason I came in and was never my main diagnosis. So one of the things that I think, Ray, you mentioned from Bruce's talk, and also something I learned, is that you have to be very proactive in your own care. And this story will continue on, and you'll see why I say that as well. So afterwards, they sent me home. I had a wound, I had the ileostomy, I had a beta blocker and aspirin, which I'd never been on before because of the heart thing. So it was determined medical management was sufficient. They didn't have to go in and do a cath or anything else. So now I'm in the process of healing. I'm losing tons of weight. The proximity of the wound and the ileostomy was just a nightmare. I have to say, my husband, if he can deal with helping me change that, I'm not turning him in for another one ever, ever. I mean, it was awful. For a while, it was awful. But I got used to it. And what ended up happening is I had that for 6 months, and they had told me that hopefully I would be able to have it reversed. Okay, sometimes you can have it for a while and then you heal up and they can go back in and reattach you, okay? But meanwhile, I did finally go see cardiology, and I didn't remember seeing cardiology when I was in the hospital, but there are a lot of cardiology notes. So apparently I did see them, but I saw like internal medicine, I saw the surgeons, I saw cardiology, and I didn't even know who was who's a PA, who's a doctor, whatever, until I just went back and looked at the notes in there. And interestingly enough, the cardiology notes say that they discussed the information, because these were mostly PAs that saw me, and they discussed the information with Dr. Hinchman. But I never saw him when I was in the hospital. And I was referred to St. Luke's cardiology as an outpatient. So I finally got an appointment with them, and they said the same things that I heard in the hospital, okay? and I had another echo at 3 months, and my ejection fraction was a little bit better. It was like 40 something. So that was really encouraging. And then I insisted that I wanted to cardiac rehab. And they didn't know if my insurance would pay for it, but it ended up my insurance did. I did that here, and that's when, I'm sure it was Dennis that came and spoke to us about Mended Hearts. And I had a great experience with the cardiac rehab, and I started coming to these meetings and met many of you people, and I've been doing that ever since, so it's been 2+ years. It took me a while to I wanted to be able to give back because I learned so much. It took a while to get all the things done that I needed. I was originally gonna do St. Luke's, but then I could never connect with the volunteer coordinator there, so that didn't work out, but finally St. Al's took me, and I've been over there this year and a bit of last year visiting patients over there. I saw cardiology again, and there was really no change. I saw them a couple more times, and so this would have been 2022, 2023. I ended up in February of 2023 getting reconnected. Unfortunately, that turned into that was 11 days in the hospital, because once they reconnected me, things were not coming, and they won't let you go home unless you're able to eat, you can poop and pee and all that good stuff. Well, it wasn't working. So they gave me everything in their arsenal to get me to poop, and kind of overdid it. And so they finally did get me to go home, but I ended up with a C. diff infection.
Shoot.
Yeah, so that lasted for months because the antibiotics did not. It was like 3 different antibiotics, and finally months later it just kind of tapered off and it's got a little bit better. So that whole year was pretty much lost in my life as far as I can remember. So finally though, I got another echo at 6 months or a year, and it was like in the 50s. So my heart failure seemed to be really improving, which I didn't realize that heart failure could actually get better. And then 2024, I just kept seeing cardiology, but I just saw PAs, and they weren't doing anything, which was not inappropriate necessarily, but I really felt like I wanted to see a cardiologist. And so this was in the back of my mind, because they told me I'd had a heart attack, and it's like, how do I know? I actually had an ER visit when I had chest pain after my surgery, because how do I know if I'm not having another heart attack? How am I supposed to know? It wasn't, but I guess if I drop dead like my dad did, then I'll know. So gradually kept getting better and better. But last year, after coming to sessions here, and Dr. Hinchman had actually come to one of those sessions, and Dr. Nelson, both of whom had said things that sort of jogged my brain, and they had talked about stress-induced cardiomyopathy. And I actually, after Dr. Hinchman left, I forget when last year he came to speak, but I kind of grabbed him on the way out and I said, you probably don't remember me, but you saw me in 2019, and gave him just a brief history, and he was like, yeah, I'm not really sure that you even had a heart attack. It may have been sort of that stress-induced cardiomyopathy. I'm like, So that just sort of sat in my head, and he had told us about his independent cardiology practice, and I just kept thinking about it, and last summer, my husband and I went hiking in southern France. And the year before, we had hiked in Spain for a month. And that went well, and so we went back and did another part of this trail that goes all through Spain and France. It turned out that there was weather. We had some 20-mile days of hiking, and the weather was unseasonably warm, up in the 80s with some humidity. And so after about 3 days of that, I just totally crashed. And my husband we had friends, they had some electrolytes, they got me feeling a little bit better. But that was very scary, and there were times when we were walking up hills that I couldn't even carry my little day pack, and then my husband had to do it for me. And I was like, something is really wrong. And so, because I've been able to do this before. And so when I came back, you know, because I was telling my husband, I said, yeah, I need to follow up with cardiology. And so, but I didn't really have chest pain. It was just shortness of breath and trouble doing what I was there to do. We got through it all, got home, and I decided I was gonna go see Dr. Hinchman. So I called them, made an appointment, finally got in to see him, I kept delaying my calling like I tend to do. It's like, oh, you know, maybe tomorrow I'll do that, you know. So finally got in to see him in November, I think. And he set up to do a bunch of different tests because he, again, wasn't sure that I had an actual heart attack. So he did a PET scan, heart PET scan, and then that turned out to be normal. Well, his words were, it's reassuring. And then a cardiac MRI. Has anybody ever had one of those?
Mm-hmm.
Wow. Yeah.
With contrast.
Yes, with
Yes.
contrast,
Mhm.
yes. And so I had just finally found the results for that today, because they told me, he said, that's reassuring too. But when I actually read the results, it said everything was normal, and the wall motion abnormality that they said I'd had in the echo in the hospital, there was none of that in the cardiac MRI. So, and then I had another echo, which showed my ejection fraction at 62%.
Wow.
So everything came back. I mean, I still have cardiac, CAD, coronary artery disease, because I've got the calcium in there, but it's non-obstructive. There's nothing that they need to go in there and treat except with the medications. So my lesson here is be persistent, be sure to get the treatment that you want. I'm supposed to go back in 6 months, so I'm really happy that it's not a year. And if it were a year, I would be asking for 6 months too. Get help interpreting results if you don't understand what they are. There's still a lot of things that I'm not sure what they are, and that's having worked in a hospital for 30 years. So it's, you know, things are really complicated when you have other things going on. So, and I don't know, you know, you gotta stay on top of it because things change, right, over time. Like AFib, you still have AFib, you know.
We still get older.
And we still get older, so other things are gonna happen. So, and that's my story, and I'm sticking with it, so.
That was great.
Wow.
Question?
I want to point out my experience in a little bit to you on your hiking trip,
Okay,
and you had like 80-degree temperature and humidity. I find too that once it warms up, you have a tendency you don't want to eat too much. but I found that sometimes I would get a little bit loopy in my head when I'm outside the garage. And I have the electrolytes, and I found that those were a big help for me. And they go down real easily, warmers for me and everything.
Yeah,
And that's been, older people don't like to drink,
yeah,
because you know what, you gotta head to the bathroom,
right,
all right?
right.
That's an annoyance. But
Yeah.
I found drinking is really, really important when you think you don't need it.
Right.
You do need it.
Right, and I don't think, on that third day, I don't think we had eaten nearly as much, cause we were dependent on if there was a place along the way kind of thing. Yeah, that's very good. I need to keep that on hand now, which, yeah. Cause I've noticed too, as it gets warmer, you know, initially after my surgery, to even just take a shower. And that particular day when that happened, I had those same symptoms, you know, like my heart was not able to function normally, so. Anybody else? Thank you, thanks for listening.
Thank you, Barbara.
Thank you, Barbara.
Look forward to hearing more of all of your stories. I don't know
Well,
all of your stories
one
yet.
thing that I understand now why all these hospitals are doing the expansion, she's paying for it. My God, with all those visits,
So-
my Lord.
My hospital bill,
No,
so,
oh,
well, you know, Medicare, so I had Part A. I never have had Part B because, my husband is 6 years younger than I am. And when I stopped working, he was under my health care. And so I kept the same insurance from the VA, which is where I worked. And I didn't want double insurance. When I turned 65, I would have had to sign up. And so now, if I sign up for Medicare, Part B, I have to pay, I think it's 10% penalty for each year that I did not sign up. It's insane. And so I really, I mean, I have good healthcare, and he's on Medicare now, that he's 65, but I am not, and so, but they still went by, in the hospital, they went by what Medicare charges. So I got a detailed list of my hospital stay, and it was over $100,000, of which I did have to pay because my insurance wouldn't cover those inpatient doctor visits. And there were, you heard me, there's like 3 different ones almost every day that they came for a while. So, yeah, I had a few $1,000s to pay, but not that 100,000, so.
well, we'll name the new wing over there.
Ray?
Yeah.
Speaking of hospital bills, I looked at the hospital bills that I had after my first several ablations and procedures and hospital visits. It was $750,000. It was billed. I didn't pay a penny of any of
Yeah.
that because I have Medicare and I have Blue Cross Blue Shield Federal because I was forever retiring. So I have good insurance. But if I didn't have insurance, I don't have any idea how much I would have been charged, because you can't tell. Because the hospital, they say, well, this is the charges, this is what they charge Medicare and Blue Cross Blue Shield spent about $45,000 of that $750,000.
Right.
And there was nothing in, so who's paying the rest of it?
Dennis. By the way, those of you who don't know Dennis, he's loopy a lot. So just don't take it for granted that because he was outside, he got loopy, okay?
Well,
He's loopy a lot.
I think what happens though, Bruce, is like when you get, like when I get I have Blue Cross Blue Shield Federal. When I get those little, what do they call them? The things you get in the mail that says,
It's
How
not
much?
a bill,
yeah, how much that they charged, how much the insurance is gonna pay, so the reasonable cost. So Medicare sets a limit, so even though the hospital charges this much, they don't ever get it.
They never see it.
Because they're crazy amounts of money.
Well,
Yeah.
not from you, but find yourself without insurance. and you pay
That's true.
rack rate.
Now, if you call.
That happened to me.
If you
Really?
call-
Yeah.
If you call the hospital, you call St. Luke's or St. Al's and say, how much is an appendectomy? What insurance do you have? They will not give you a number until they know what insurance you have. That's wrong.
It is wrong.
It's
Yeah.
absolutely wrong.
Well, and a lot of doctors' offices will not take Medicare patients because of that very reason, because Medicare pays so much less than what the doctors charge, that, you know, you call them many times, and they'll say, I'm sorry, our doctors don't take Medicare. And
Well,
so
again,
that's why.
thank you for the stories.
Yep.
More importantly, those of you who are watching at home, if you learned anything
No,
about the
well,
meeting today,
It's all good,
So
right?
come to a
informative,
meeting.
Yeah.
Yeah.
Come to a meeting. That's how you're gonna meet these doctors. That's how you're gonna find out more about your health.
That's the other lesson.
You don't wanna come to a meeting? I'll be at your funeral, but come to a meeting, hear the doctors talk, hear what they have to say, ask them questions. The most important thing, many important things, keep learning. Well, I wrote that down because you need to keep learning if you wanna be better. You're not gonna get better just because you wish it. I also love the one, I want to know more. I also would like to know how you get your ejection fraction up, because I struggle with that one all the time. More
Well, I
important.
think that the thing about that is the stress-induced cardiomyopathy, that whole thing was that I had a heart issue because of the surgery,
Oh,
okay? So it looked like I had a heart attack, but I did not.
well,
And so you know, if you had a heart attack and you have heart failure, that's totally different, and you would not necessarily be able to increase your.
now don't say that, because I blame my ejection fraction on my wife. That's the reason it's down. Okay, but, thank you again for a wonderful presentation, a heartfelt presentation. I was crying there with you. Yeah, that was remarkable. Okay, the next person we have on our list is a person that's always kind of shaky. Dennis is gonna talk a little, oh, no! Becky, can you sort of like throw things at me periodically? We have the treasurer's report and membership report.
Well, this is a standing item on the agenda, but I don't have anything that's earth-shaking new. You all generally know that, we bank with the, Mended Hearts Inc. banking at, Synovus in Georgia, and that we can file for reimbursements whenever we need to for, chapter-related expenses. For membership, I keep track of all names and email addresses and phone numbers given to us through cardiac rehab or chapter meetings, et cetera, and put them on distribution lists so that we can stay in touch. And with our change to Google, that has been a wonderful improvement to when we were using MailChimp, because with our nonprofit status, this particular program is much more cost efficient, and we can stay in touch with emails to, blasts to multiple folks whenever we need to, and not worry about, are we running out of credits to contact our members or interested guests. And as long as I'm up here, I'll talk about accredited visitor updates. At this point in time, I'm standing in for Jack Marr, who's retired from this position. And we had one individual who seemed interested in becoming accredited, but hasn't followed through with the hospital volunteer criteria yet. So I'm at this point just tracking those who are accredited already, as we do annual reaccreditation. That's mostly online and a formality at this point, but the training is done with PowerPoint that is produced by Mended Hearts Inc. So that's what I have.
Thank you, Becky. That was excellent. membership's free, we'll take your money, but, it's free. And if you are using all the tools that they give you, from Mended Hearts National, you're foolish if you don't. The forum out there is unbelievable. They got speakers coming up. I signed up for one on obesity and your heart. Not that I needed it, of course, with my stomach, but they have a seminar coming up on it. If you're not signing up for that stuff, it's free. Remember what the two speakers talked about? You wanna know something? Ask. If you wanna know more, keep learning. Come on, same stuff. With that, it's my honor to introduce Dennis. Is a individual who has done more for this organization than many of us, myself included. He does a lot of work behind the scenes we don't see, and Dennis is gonna talk to you about cardiac rehab.
Thank you, Ray. Cardiac rehab, Ray and I did it yesterday. 78 people we talked to, and we've got about, what, dozen people, 13 people signed up that wanted further information. So that's a good thing. So, as we all know, there's gonna be, can't hear me back there? Raise your hand, please. Quit going in circles. We're gonna be replaced by a Pritkin program in cardiac rehab. But there's gonna be something good to come out of this. Josh Baker has come up to Ray and I and asked us to continue doing this Pritkin education that's gonna be going on in this very room, starting in mid-April sometime. And we will be allowed to continue in a Mended Hearts capacity. We'll have a table set up for ourselves. We'll be getting free education courtesy of St. Luke's. And they're gonna have so many classes a day, and a class will be about 45 minutes long. And I don't know how many classes a day, but we'll be here and we'll be able to spread the word about Mended Hearts and not be booted out as we thought. So
Lovely.
it's a good thing.
Yes.
And some of the things that you're, afraid about, that we would not have that anymore, we will have that for as long as Ray and I wish to do that. I think that's gonna be good, because they said, well, we're gonna also do some food classes. So I guess they're gonna feed us, which would be good, because the only thing we've ever gotten over there. Hey,
Have you ever done Pritikin before?
I have no
You
idea.
may not be, so.
I have no idea. I have no idea what it
Okay.
is. But, go ahead.
It's just very, very low fat, very low sodium, very
Bland.
vegetarian-ish.
Very blandish.
Well, from
It
what-
might be, it might not be.
From what I understand, okay, this is something that's been ongoing in cardiac rehab over here. They've been thinking about doing this for about the last 7-8 years. So this is,
Becky has forms.
well,
I'll put these out for people to
Yeah.
take a.
there's some
or I can
cards
pass
over
them
here,
out even.
info cards. And they decided that, it wasn't us that they thought was doing a bad job. They just thought that they needed to reach out to the patients, because nutrition has a lot to do with it. And I think a lot of these patients go home and maybe some of them do real good and some not so good. Cindy?
Is the, how do you pronounce it again?
Pritkin.
Yeah, that. Is it different than the lifestyle medicine, I don't know, my husband and I.
To tell you truthfully, I haven't looked at any of this yet, but I'm gonna try and get some more information. And at next month's meeting, I'll give you a little bit what I can find out.
Okay.
And pass it on from there, but
Great.
I'm sure it'll do a good thing, because that class will be about 45 minutes, in addition to the 45-minute cardiac rehab class. So,
Yeah, and this was something that was attended, that my husband and I attended along with many patients, in the evenings, every week for several weeks, for like an hour and a half, 2 hours a night.
well, it's gotta be a good thing, you know what I mean? All of us want to improve somehow, and a lot of people, well, really don't. So you gotta kinda take them by the hand a little bit.
Yes, absolutely.
That
I'm
won't
one of
hurt.
those.
No, that won't hurt, you know, so whatever I can steal from the class over there, I'll pass it on over here.
Are they, so they're doing the normal, well, the same way they're doing the cardiac, the exercise piece, right now?
Right.
As far as you know? And then, so the patients will do their rehab there, and then they'll come in here for a
Yes,
45-minute class?
so I'll have 2 45-minute sessions, as I was told, you know, to understand. And so they'll be here a little bit longer during the day. So, that's,
I'll be able to add to that when I come talk.
okay.
Can I come sit in on some of the classes with you guys?
We'll get to that question.
Okay.
Yeah. We'll
Well,
see.
yeah, that question will come up in a minute.
Okay, that'll be it.
Thank you. Well, we didn't mean to cut him off, but we're going to address that in just a second, okay? The next one, I'm gonna follow the list because I get spanked when I don't here. Nancy, would you like to please come up and give us an update on quarterly newsletters, please?
Well, as you all know, Bruce has decided he'd like to actually retire. And after much arm twisting and everything else, we haven't been able to convince him that he should continue to do the newsletter. But we found that Mended Hearts International, or Inc., this last year, started sending monthly newsletters. And so what we're going to do is create our monthly newsletters, taking the material that's coming from Mended Hearts Inc., and then adding in the front page and the back page to highlight things that are happening in our particular chapter. And that continues to give us something as visitors to hand out to the people that we visit, and to have something that they have as a takeaway with information about how to reach us and that we're there for them. So, any suggestions that you have on improvement or how we can make this better, that's great. We do want to, however, contain it and keep it easy to do. I already had a pretty full-time job maintaining the website and database, and so taking on this too, I do want to try to keep it contained as much as we can. So taking that information from Mended Hearts Inc. is really going to help us out.
I wish that Mended Hearts Inc. would make their information, or put information here that was more heart relevant. There's a lot of things in here that are just like, I mean.
I fully agree compared to what we
traveler's
got.
planning and legacy, you know, treasures in your attic and
Right.
diabetes, but they don't link it with heart. And so I have found, I've delivered to all the offices the fresh, you know, the winter newsletters.
Yeah.
And I found that I picked up a lot that people have not been picking up. I mean, I blamed it all on him because I told him, I said, Bruce, you set the bar so high that we are, you know, not meeting that, and so I wish that somebody could talk to Mended Hearts Inc. and say, hey, we are international, and say, we really need this filled with heart stuff.
Well, especially given all of the research and all of the information
Oh, there's
that's
so
on the
much
Mended
out there.
Hearts International or Inc. website. I mean, there's a ton, and why can't they just take little cuts from that?
And so I think people are
But
starting to.
we did get very spoiled with Bruce's
Well,
great
we
work.
did, yeah.
Yeah,
But I
he
think
spent a
people are
lot of
like-
time researching.
people are going into the doctor's offices and reading it once and they don't go back, and I don't know, maybe I'm not trying to be negative, I'm just saying if there's any way that we could talk to them, to the main office and say, you know, a suggestion would be, cause there's so, like you said, Nancy, there's so much out there.
There,
Yeah.
Take the heart guide and take an article out of, there's 80
fine.
pages of something in the heart
Right.
guide.
Yeah,
Every one of those pages has something that they can put in the newsletter.
very true. Yeah, I will give that feedback to Kim and hopefully she doesn't.
That'd be great. Bruce, you did an awesome job.
Yeah, I think we got
with
pretty
our
spoiled.
newsletter.
Yeah.
But this is the reason a lot of us are here, right? Is because, you know, the great information that you see in that newsletter make you wanna come and learn even more.
Right.
All right, thank you.
Thank you.
Thanks, Nancy.
Nancy, that's a great compliment for Bruce. For those of you who don't know, Bruce has won worldwide twice, if I remember rightly. His newsletter is unbelievable, and Bruce is unbelievable. That's why I love him so much. He does a fantastic job. Any of you listening to this, if you have any questions, don't be scared to pick up the phone and call Atlanta, Georgia. They don't bite. They're very nice people down there. If you have anything you need to have, you thought, please call them. Hey, why don't you change your newsletter to this? Why don't you do that? And by the way, they're not gonna accept you as a volunteer, so don't worry about it.
Oh, good.
I'm still accepting volunteers up here. Okay, with that in mind, Pat is gonna talk about our program and a very important part of the program that she needs to have for their next meeting. Pat is our program chief cook and bottle washer, and she does a very outstanding job, everything. I wanna back up for a second. Nancy was just up here talking about the newsletter, talking about the website. Nancy is a beautiful person, volunteers with a service dog. She does an awful lot of work. Those of you who are watching out there, volunteer. Put your heart out there where it needs to be and help people. Thank you, Nancy, for what you do for us. Pat, please share.
Yes, thank you, Nancy, you definitely deserve recognition because you do so much. I'm kind of between a rock and a hard place, and I'll kind of explain the whole picture. Dr. Hinchman had something come up at the clinic and cannot speak next month. And she said, she being Alexis, who's kind of the head gal over all these doctors telling where to do and where to go, when can we reschedule? And I said, I don't know, basically, and here's where my problem is. I don't know where we're gonna be meeting, and I don't know what time or what day of the week. So I can't very well approach any speaker from this point on and say, hey, we need you to talk to us, we'd love to have you come in. And so I'm waiting for all these major decisions to be made before I can progress on. But I was kind of in a panic state. It's like, okay, what do I do for March? You know, we've got this room, and I talked to Josh Baker, and he is going to come in. And I'm not sure, Barb, you know who he is. I mean, he's the one that's kind of he's been in charge of the cardiac rehab program, and he's kind of up there. So he's obviously in touch with this Pritikin. I mean, I'm sure he can get messages to them. And so I called him and I said, would you be willing to come in March and talk to us? So he'll be able to answer these wonderful questions that I've heard from everybody. And you know, and that's what I'm asking people, please come in with your questions, or better still, if you could email them to me, I'm gonna contact him, I'm gonna email him and say, look, I've got a list of questions. This way he'll be able to prepare and know, you know, have some answers. And if he doesn't know now, he'll be able to, you know, be ready for the meeting in March. And so if you could email me, anybody that has specific questions, I think, or call me, and I'll write those down and then email them to him. So that's kind of where we're at right now, but I'm really happy that he was able to step in. I mean, that was kind of a last minute thing, and I think his talk will be very appropriate for us. Because right now I feel kind of like I'm out wandering around in the wilderness, you know, not knowing quite what to do with my part of the program. So anyway, I appreciate once again, any input from anybody as to possible potential speakers in the future, so.
Thank you, Pat. One of the things Pat could also use is suggestions. So anybody who's got a individual dentist or somebody that would like to speak, anybody at all, please let Pat know. Thank you, Pat, there's another lady that does more than you think. Pat takes brochures, takes our point of sale, distributes it all over the valley, and we take that for granted. And Pat, we don't take that for granted. Thank you very much for doing that. That's very kind of you. Okay, we're into new business. Ta-da! What's our new business out there? It's this thing on the back page here that we gotta fill out and deposit on that table in the back. It's called Mended Hearts of Boise, Chapter 380 Survey. Those of you at home, mail it in to the address that we're gonna supply, or just put it on an email and send it back in. So we want your input, okay? Otherwise, we'll hold these meetings at Dennis's house and you won't be very happy, okay?
Nancy, did you get mine?
Do you have a question, Dennis?
Yes.
Anybody have a question out there?
Get your what?
Any questions? Any new business?
I'll look.
Anybody wanna say this meeting is adjourned? I hear one motion, another one,
Motion to
second.
adjourn.
All in favor, say aye.
Aye.
Thank you, all of you, very much for coming.